Hey, before you scroll past this video, I want you to do something really quick for me. Take off your shoes and socks right now if you can and just look at your feet. I'm serious. Just take a look at them for a second because what you're about to discover in the next few minutes could genuinely change your life or maybe even save it. And I'm not saying that to be dramatic. I'm saying that because every single day in clinical practice, I see patients who walked around for months, sometimes years, with warning signs written all over their feet, and they had absolutely no idea that their body was desperately trying to tell them something was seriously wrong. I'm Dr. Edward Hamilton, Senior Health Advisor, and I've spent decades working with patients managing chronic conditions. And diabetes is one of the most misunderstood, most underdiagnosed conditions we deal with in modern medicine. The scary part isn't even the disease itself. The scary part is how silently it creeps in. People joke about it. They ignore the early signs. And by the time they finally sit across from a doctor and get that diagnosis, significant damage has already been done. And here's the thing that most people don't realize. Your feet are like a mirror for your internal health. They will tell you what's happening inside your body long before any other obvious symptom shows up. So today we are going through 9 specific warning signs in your feet that doctors, including myself, warn you should never ignore. These aren't random internet theories. These are clinically recognized signs that healthcare professionals are trained to look for. And by the end of this video, you're going to walk away with knowledge that could genuinely prompt you to get checked before things go too far. So make sure you stay with me all the way through, because some of the signs later in this list are the ones people miss most often, and they tend to be the most serious. All right, let's get into it. The first sign I want to talk about is numbness or tingling in your feet. Now, you might think, oh, my foot just fell asleep. That's totally normal. And yes, occasionally that happens to everyone, especially if you've been sitting in a weird position for too long. But I'm talking about something different here. I'm talking about a persistent recurring numbness, or that pins and needles sensation that doesn't have an obvious cause. Maybe you wake up in the morning and the bottoms of your feet feel strangely numb. Maybe you're walking around and you notice that tingling sensation that just kind of doesn't go away. That is a significant red flag. What's happening in the body is something called peripheral neuropathy, and this is one of the hallmark complications of diabetes. When blood sugar remains elevated for an extended period of time, it begins to damage the nerves throughout the body, particularly those long peripheral nerves that travel all the way down to your feet. These nerves are responsible for sending sensation signals back up to your brain. So, when they get damaged, the first thing you notice is that the sensation starts to go haywire. You get tingling. You get numbness. Sometimes that weird burning feeling that I'll talk more about in a moment. And here's the concerning thing about this particular sign. By the time you're feeling significant numbness, nerve damage has often been accumulating for quite a while. This is not a new development. This is your body saying it has been struggling for some time. So, if this is something you've been brushing off, please don't brush it off anymore. The second sign is a burning or painful sensation in your feet, especially at night. Now, this one sounds counterintuitive when I just told you about numbness, right? How can you have both numbness and pain? Well, that's actually exactly how diabetic neuropathy often works. The nerve damage doesn't always just turn things off. Sometimes it sends incorrect, exaggerated signals. So instead of normal sensation, you get this burning, stabbing, or even electric shock-like pain often in the feet and lower legs. And a very telling characteristic of this pain is that it tends to be worse at night when you're lying still and trying to sleep. Patients describe it to me in so many different ways. Some say it feels like their feet are on fire. Others say it feels like they're walking on broken glass, even when they're just lying in bed. Some describe it as a deep aching that moves through their feet and ankles. If any of that resonates with you, please take note. This type of pain, especially when it's symmetrical, meaning it affects both feet in a similar way, is a classic presentation that we associate with diabetic nerve involvement. And the reason it gets worse at night is partly because during the day, the distractions of normal activity mask the sensation. But at night, when everything is quiet, that nerve signal is all your brain has to focus on. Don't dismiss this as just tired feet from a long day. This is your nervous system raising a flag. Sign number 3 is changes in the skin color or texture of your feet and lower legs. This one is really important, and a lot of people walk right past it because they chalk it up to dry skin or just getting older. But there's a big difference between normal dry skin and the skin changes that occur as a result of impaired circulation and nerve damage from diabetes. When blood sugar is chronically elevated, it damages the small blood vessels throughout the body. This is called microvascular disease, and the feet and lower extremities are among the first places where this becomes visible. You might notice that your skin becomes unusually shiny, almost like it's stretched or tight over the bones of your feet. You might see that the skin becomes very thin and fragile, almost translucent in some areas. Some people notice a loss of hair on their toes and lower legs, which happens because the hair follicles are no longer getting adequate blood supply. Others notice a yellowish or brownish discoloration, sometimes patches of darker skin around the ankles or lower shins. In some cases, people develop what's called diabetic dermopathy, which shows up as small brownish, slightly scaly patches, usually on the shins. These are sometimes called shin spots. And while they're harmless on their own, they're a very strong indicator that blood sugar control has been poor for some time. If you're looking at your feet and legs and the skin just doesn't look the way it used to, that's worth paying attention to. Now, let's talk about sign number 4, and this is one that genuinely startles my patients when I explain the significance of it. We're talking about slow healing wounds or sores on your feet. I've had patients come in with a small cut or a blister that they got weeks ago, sometimes months ago, and it just hasn't healed. Maybe it's gotten a little better, but it keeps stalling. Or maybe it healed on the surface but keeps reopening. And for so many of these patients, this is actually the moment they first discover they have diabetes. Here's why this happens. Diabetes impairs healing through multiple mechanisms simultaneously. First, the elevated blood sugar actually provides a rich environment for bacteria to thrive, so infection risk goes way up. Second, the damage to blood vessels means that oxygen and nutrients can't reach the wound site efficiently, so the healing process is dramatically slowed. Third, the nerve damage means you might not even feel the wound in the first place, which means it can get significantly worse before you even notice it's there. And fourth, diabetes affects the function of the immune cells that are supposed to fight off infection and initiate repair. So, you've essentially got a perfect storm of conditions that make even minor wounds on the feet extraordinarily dangerous. In the medical world, we have a term for the severe end of this spectrum. It's called diabetic foot ulcer, and it's one of the leading causes of non-traumatic lower limb amputation worldwide. I'm not telling you this to scare you unnecessarily. I'm telling you this because I want you to understand the stakes. A cut that doesn't heal is not just a small inconvenience. In the context of unmanaged or undiagnosed diabetes, it is a medical emergency waiting to happen. If you have a wound on your foot that's been lingering for more than 2 weeks without significant improvement, you need to see a doctor. Full stop. Sign number 5 is swelling in the feet and ankles. Now, swollen feet can happen for lots of reasons. You might have been on your feet all day. You might be pregnant. You might have a minor injury. So, swelling alone doesn't automatically mean diabetes. But when swelling is persistent, recurring, and accompanied by any of the other signs I'm mentioning in this video, it becomes a very important piece of the puzzle. In diabetes, swelling in the feet and ankles can occur for a couple of reasons. One is poor circulation. When the blood vessels are damaged and blood isn't flowing efficiently, fluid can pull in the lower extremities. Another reason is kidney involvement. The kidneys are another organ that diabetes loves to damage over time. And when kidney function is compromised, the body starts to retain fluid, which often shows up first in the feet and ankles. There's also a condition called SCO foot, which is a serious diabetic complication where the bones in the foot weaken and can actually fracture and shift without the person realizing it because of nerve damage. And this can cause significant swelling and deformity. So, if your feet and ankles are consistently swollen and you don't have a clear explanation for it, that's not something to wait out. Moving on to sign number 6, and this one is really fascinating from a clinical perspective. We're talking about changes in the shape or structure of your feet. Now, most people assume that foot deformities like bunions or hammer toes are purely mechanical problems, maybe from wearing bad shoes. And while footwear does play a role, there's a strong connection between neuropathy from diabetes and the development and worsening of these structural changes. When the nerves that control the small muscles in your feet are damaged, those muscles can no longer do their job of maintaining proper alignment. So the mechanical balance of your foot shifts, and over time, deformities develop. Toes start to curl or claw. Pressure points develop in unusual places. The arch of the foot may change, and because of the accompanying numbness, you often don't feel the pain that would normally prompt you to seek care. What you might notice is that your shoes are fitting differently, or that you're developing calluses in unusual spots, which I'm actually going to talk about next. But the structural changes in the foot are a real and recognized sign that neuropathy may be at work. Sign number 7 is thick or unusual calluses. And this one catches people off guard because we tend to think of calluses as just a normal thing that happens to feet. And to some extent, that's true. If you're on your feet a lot or wearing certain types of shoes, some callusing is expected. But there's a particular pattern of callusing that raises red flags for us clinically. In diabetic patients with neuropathy, the altered walking mechanics I mentioned a moment ago create abnormal pressure points. The skin over these pressure points builds up calluses as a protective response. But here's the problem. Underneath those thick calluses, ulcers can be forming and progressing completely undetected because the patient can't feel what's happening under there. The callus acts almost like a disguise for a wound that's getting worse by the day. Additionally, the calluses themselves can crack, and those cracks become entry points for infection. If your calluses are thick, spreading, and particularly if they're developing in unusual locations like the balls of your feet, the sides of your heels, or under your toes, that's worth discussing with your doctor. Combined with any other signs in this video, it becomes even more significant. We're at sign number 8, and this one is particularly sneaky because it's not something most people would intuitively connect to blood sugar problems. We're talking about fungal infections of the feet and nails, specifically recurring or stubborn ones. Now, everyone can get athlete's foot or a fungal nail infection. That's not automatically a cause for alarm. But when these infections are unusually persistent, keep coming back repeatedly, or are particularly resistant to treatment, that pattern is something we pay attention to. Here's why. Elevated blood sugar creates an internal environment that fungi love. Fungal organisms, just like bacteria, thrive on sugar. So, if your blood sugar is chronically high, you are essentially feeding these organisms from the inside, making it nearly impossible for your body's immune defenses to keep them in check. People with undiagnosed or poorly managed diabetes often struggle with recurring athletes, foot between the toes, thick yellowing toenails from fungal infection, and persistent itching or scaling on the soles of their feet. They try over-the-counter antifungal treatments and get some relief, but the problem keeps coming back because the underlying cause, the elevated blood sugar, is never addressed. If this sounds like your experience, it could be telling you something very important. And now we've arrived at sign number 9. I've saved this one for last because in my experience, it's one of the most overlooked, and yet it's one of the most telling. We're talking about cold feet, specifically a persistent coldness in one or both feet that doesn't have an obvious environmental explanation. Most people, when their feet feel cold, they put on thicker socks. They assume it's just poor circulation from sitting too long, or they chalk it up to being someone who just has cold feet. And sometimes that's all it is. But persistent coldness in the feet, particularly when it's asymmetrical, meaning one foot is noticeably colder than the other, or when it doesn't resolve with warming, is a sign of impaired blood flow that should not be dismissed. In diabetes, the damage to larger blood vessels, what we call macrovascular disease, can significantly reduce the blood flow reaching the feet and lower legs. This is called peripheral arterial disease, and it's significantly more common in diabetic patients than in the general population. When the arteries carrying blood to your feet are narrowed or damaged, less warm blood gets through and the foot becomes cold. Now, the dangerous part of this is that cold feet from poor circulation also means reduced oxygen delivery, reduced immune function at the site, reduced healing capacity, and increased risk of tissue death if a wound occurs. Combine that with the numbness from neuropathy, and you can see how a seemingly minor problem can spiral into something catastrophic very quickly. If you consistently have cold feet, especially in combination with any of the other 8 signs I've described today, please make an appointment with your doctor. Ask specifically about your blood sugar levels, your circulation, and request a thorough foot examination. Now, I want to take a moment here because I know some of you are watching this, and you're counting how many of these signs apply to you, and maybe you're feeling a little anxious right now. I want to address that directly. First of all, the fact that you're watching this video and paying attention means you're already doing something right. Knowledge is not something to fear. Knowledge is power. And second, I want to be very clear that experiencing one of these signs in isolation doesn't automatically mean you have diabetes. Many of these symptoms can have other explanations. But when you start seeing multiple signs together, especially over a period of time, that's when your body is speaking loudly enough that you have a professional responsibility to yourself to listen. The really important thing I want you to understand is that diabetes, particularly type 2 diabetes, is often a condition that develops gradually over years. There's a stage before full diabetes called prediabetes, where blood sugar is elevated but hasn't yet crossed the diagnostic threshold. During prediabetes, there are essentially no symptoms, but damage is already beginning. The foot symptoms we've discussed today often represent a later stage of this progression, which means if you're noticing these things, your body has likely been dealing with blood sugar issues for quite some time already. But here is the genuinely hopeful part of that message. Even at that stage, intervention can make an enormous difference. Lifestyle changes, proper medical management, and close monitoring can significantly slow or even halt the progression of complications. The window for making a meaningful difference is not closed just because symptoms have appeared, but every day that passes without action does make that window a little smaller. I also want to talk about something that I think is really critical, and that's the importance of daily foot checks, if you already have diabetes or if you're in a high-risk category. The reason we recommend this so strongly is everything we've talked about today. The numbness, the reduced sensation means that a wound can develop and worsen without you feeling a thing. So, every day you should be looking at your feet. Take off your socks. Use a mirror to see the bottom of your feet if you have trouble bending. Check between your toes. Look for any redness, swelling, blisters, cuts, or changes in skin color. If you notice anything new or concerning, don't wait to see if it resolves on its own. Call your doctor that day. In diabetic foot care, time is genuinely critical. Your footwear matters enormously as well. Tight shoes, poorly fitting shoes, shoes with seams in the wrong places. These things create pressure points and friction that can lead to wounds in people with neuropathy. If you're at risk or already have a diabetes diagnosis, investing in proper footwear isn't a luxury. It's a medical necessity. Your doctor can actually refer you to a podiatrist who specializes in diabetic foot care, and that relationship can be genuinely life-changing. Now, let's talk about what to do next if you've been watching this video and you're concerned. The first step is simply making an appointment with your primary care physician and being honest with them about what you've been noticing. Don't minimize your symptoms. Don't say, "Oh, it's probably nothing." Tell them everything. Tell them about the tingling, the burning, the slow healing sore you've been hoping would get better on its own. Bring up the foot changes you've noticed. The more information you give your doctor, the better equipped they are to help you. They'll likely want to check your fasting blood glucose and your HbA1c, which is a blood test that gives us a picture of your average blood sugar over the past 2 to 3 months. This is actually more useful than a single blood glucose reading because it tells us about the trend rather than just a single moment in time. They may also do a physical examination of your feet, checking your pulses, your sensation, your reflexes, and the appearance of your skin and nails. From there, they'll be able to give you a much clearer picture of what's happening and what, if anything, needs to be done. If you're diagnosed with prediabetes or diabetes, I want you to hear this clearly. This is not a death sentence. This is not the end of a healthy life. Millions of people manage diabetes successfully and live full, active, long lives. But it does require engagement. It requires paying attention, making changes, following through with your care, and staying educated, which is exactly what you're doing right now by being here. I also want to address something that comes up often, and that's the question of who is at risk. Because I think some people watch videos like this and think, well, this doesn't apply to me. I'm not overweight. I'm not that old. And I understand why people feel that way. But the risk factors for type 2 diabetes are broader than most people realize. Yes, excess body weight, particularly around the abdomen, is a significant risk factor. Yes, being over 45 increases your risk. Yes, having a family history of diabetes matters. But people who are normal weight can and do develop type 2 diabetes. People in their 30s develop it. People who think they eat reasonably well develop it. And type 1 diabetes, which is an autoimmune condition, can develop at any age, at any weight. So the idea that you can simply look at yourself and determine you're not at risk isn't accurate. The most reliable thing you can do is get your blood sugar checked regularly as part of routine healthcare and pay attention to the signs your body gives you. Your body is always communicating. The question is whether we're listening. Before I wrap up, I want to leave you with something that I tell my patients all the time. The relationship you have with your own body is the most important medical relationship you will ever have. Doctors can test and diagnose and prescribe, but we can only work with what you bring to us. If you notice something unusual and you sit on it for 6 months before mentioning it, we've lost 6 months. But when you're paying attention, when you're educated, when you speak up early, that's when we can do our best work together. And that's really what this channel is all about, giving you the information you need to be an active, informed participant in your own health, not just a passive recipient of whatever comes your way. So, let's do a quick recap of the 9 warning signs we covered today, just so they're fresh in your mind. We talked about persistent numbness or tingling in the feet. That burning or painful sensation, especially at night, changes in the skin color or texture of your feet and lower legs, slow healing wounds or sores, swelling in the feet and ankles, changes in the structural shape of your feet, thick or unusual calluses in abnormal locations, recurring or stubborn fungal infections of the feet and nails, and that persistent, unexplained coldness in one or both feet. If you're experiencing one or more of these symptoms regularly, please make that appointment. Don't put it off until after the holidays. Don't wait until you feel worse. Don't convince yourself it's probably nothing. Pick up your phone after this video ends and schedule that appointment. Your future self will thank you. If you found this video helpful, please give it a thumbs up because it helps more people find this information who genuinely need it. Share it with someone in your life who might be experiencing some of these signs, whether that's a parent, a spouse, a friend, anyone who you think could benefit from knowing this. Subscribe to the channel if you haven't already, because we put out new health content regularly. And I want you to be part of this community and drop a comment below. Let me know if any of these signs resonated with you, or if there's a specific health topic you'd like me to cover in a future video. I read the comments, and your input genuinely shapes what we create here. I'm Dr. Edward Hamilton, Senior Health Advisor, and I'll see you in the next one. Take care of yourselves. Take care of your feet.